Addressing mental health needs can be a multifaceted challenge. Sometimes you need a one-on-one approach. Other times, though, an entire family is involved in a care plan. Taking it a step further is to look at the needs on a community level. We're learning more about that in this sponsored segment, talking about the mission of Syntero. I am happy to welcome to the show today the Chief Clinical Officer with Syntero. That's Sara Harrison-Mills. Thanks for being on the show with us, Sara.
Thank you so much for having me, Robin.
Now, mental health and well-being is becoming such a priority for so many people, which is great, right? We're seeing a lot more of that. So tell us about Syntero and the services that you offer.
So Syntero is a nonprofit community behavioral health agency. We have been serving the Central Ohio community for over 40 years. We have 4 outpatient offices located in the Columbus area, Dublin, Hilliard, Northeast Columbus, and then Lewis Center. We provide a wide variety of services from outpatient mental health and substance use counseling to psychiatry, case management, older adult aging supportive services, and we have a very large school-based program which serves 12 school districts across 3 counties in Central Ohio.
Okay, and I want to talk now about your core values, and that is integrity, empowerment, innovation, and inclusiveness. So how do you incorporate that really into your operations, into what you do with clients on a daily basis?
So our values are really at the heart of our work. So we really strive to make sure that we're creating a very safe, healing environment for our clients, but also for the people that work with us, for our staff, for our community partners, for family members that may come to us for consultation or for care and support for their loved ones as well. We work hard to make sure that the services that we provide are cutting edge, that they're innovative and responsive to the emerging needs of our community. We are an agency that is here for everyone, so we really value diversity. We want to make sure that all of our providers are culturally responsive to the individual needs of the clients and the communities that we serve. We are working towards the success of everyone, so the success of our clients and improving the quality of their lives, as well as the success of our communities that we're embedded in.
Sara, talk a little about Syntero's culture. How would you describe it?
I would describe Syntero as having a very supportive culture. So we provide the highest quality of care, but we strive to create an environment of support. Our staff members that have come from other organizations will share that it feels different when you walk in. We have very friendly staff that are welcoming, supportive to our clients, able to answer questions and make sure that we're addressing any concerns that come up so that we can focus on the work that we do and our mission, which is to serve the community.
And how then does Syntero impact your clients and impact the surrounding community? What would you say to that?
As you are well aware, mental health needs have significantly increased. There have been a lot of mental health concerns in our communities even prior to the pandemic. So Syntero really strives to meet people where they are. To help them make sure that they understand how to navigate our complex behavioral health system, how they working on building coping strategies to manage the stressors we've been faced with, learning about the different resources and supports that are available in the community. So we do a lot of different educational presentations. We make sure that we are working with individuals one-on-one, but then also helping them to build their own support network so that they have the supports they need to be able to navigate those different stressors that life has presented us with, especially over the past couple of years.
We don't often ask people from the employee-employer kind of viewpoint, but what drew you to Syntero?
So I am from out of state, so I did not know much about the different behavioral health organizations in Central Ohio when I moved here. I've been with Syntero for 11 years now. And what really drew me to the organization was how embedded they are in the communities. We live in the community, we work in the community, we are directly connected to the well-being of our community. And I think that's something that sets Syntero apart. We've developed lots of different kinds of partnerships and collaborations with other entities. We work closely with police departments and school districts and municipalities to address the mental health needs of our community. It really does take a village, and I think Syntero has demonstrated a commitment to being a part of that village and to developing those key partnerships to allow us to have a greater impact.
Absolutely. If you want to learn more, syntero.org, a great place to start. Lots of resources there. Sara, thank you so much.
Thank you so much, Robin. It was a pleasure.